Welcome to the weekly blog sponsored by Spectrum Ed. My name is Dr. David Hutchings. Quick announcement, we do have a couple of upcoming seminars that we are doing both for the NARA group. Number one, the first one will be in April. We have a couple days we bounce around, but as soon as we have those days, I'll make sure I announce that. And then we're going to follow that up with a second seminar, different, same topic, but different slides, a kind of continuation on it, both on the subject of Alzheimer's disease and COVID. So we're going to make sure that we cover both those quite in depth because I've gotten a ton of questions about that, down to having the vaccination, the impact of COVID on dementia patients, not just Alzheimer's, but all forms of dementia. So I'll make sure that I keep y'all up to date on that. One of the things I want to cover is I had a couple of emails and a couple of questions about this, and I'm seeing more and more patients and diagnosing more and more patients with a condition that we don't see very often, but we're starting to see it more and more often, probably because we're able to identify it. And that condition is called Lewy body dementia. I did a diagnosis yesterday with an individual with Lewy body dementia, and it is a complete different type of dementia that we will see with Alzheimer's disease. Okay, these patients will typically sometimes score quite high on the neurocognitive testing pieces. However, there is parts of their symptomology that is inconsistent with other forms of dementia, and that is going to be definitely a lot of hallucination behaviors, impacts with paranoia, sleep issues. We'll see gait abnormalities. Sleep issues is the big one, because they'll not be able to stay asleep the whole night because they don't actually get into REM sleep. So it's referred to REM sleep disorder. And what we also see is that you would normally think, okay, well, that is associated with Parkinson's disease. It is. However, we will see in Lewy body that the cognitive or memory issues came before the issues with gait or other things that we would see Parkinsonian type symptoms. But hallucination behaviors is a big one with this. So one of the patients I'm thinking of right now is that seeing things, seeing dogs, seeing things running through the room, seeing people, very, very vivid hallucinations, which increases our anxiety. And then we have the sundowning issues in the evening, and then we have the sleep disorder on top of it, and then the memory issues. The next thing we see very often in this condition is it's extremely fluctuating. So there are moments that we can be, somewhat lucid, and other moments that we are just very a lot more confused. So a lot more fluctuations here. The progression of Lewy body disease is much different in terms of the course of the illness compared to Alzheimer's disease as well. And then we have the motor components that we have to deal with later on. So fall risk, those types of things, issues with swallowing, we'll see that, issues with speech, and then other motor issues with upper and lower extremities. So again, cognitive issues first, very fluctuating. Then later on, we will see some motor issues later on. And then, of course, we have the hallucination issues, the sleep issues, and a lot of sundowning. So there are ways to treat these things, but basically we have to look at the symptoms and treat the symptoms, because certainly those symptoms have to be addressed in order to have some type of quality of life through that illness. So again, we'll keep the blogs going. Thank you for the questions on this one specifically. I thought it was a cool topic for this week. So we look forward to seeing you all again next week. Thank you.